Hi Big Apple, good morning, this is Dr. Janson. Today's video is about low back pain and orthotics. If you look at the literature, there's some controversy about this. Do orthotics really help low back pain? You'll see quite a few articles that say it does, but you'll find just as many that say that orthotics do not help lower back pain. One of the problems in these articles is that the word orthotics is used very loosely. They will have over-the-counter sort of Dr. Scholl type insoles and use those in place of orthotics. And then, of course, orthotics differ very much. You have 3D printed orthotics made in factories, and then you have orthotics made the original way, the old-fashioned way, which is from a plaster of Paris model of the patient's foot. And those orthotics are all very different. So that's part of the problem. They're using the word orthotics very loosely in these research projects. Another problem is that you're going to get a different result based on your shoes. So you could wear bad shoes that don't fit and get a poor result with a very good pair of orthotics. So that's another problem. A third problem is it's difficult to quantify pain. How much pain are you having? Oh, I'm dying. I have 100 on a scale of 1 to 100. Where the next patient with the same amount of pain will say, oh, no, I can't walk. I'm laying in bed, but, I don't feel so bad. So it's very hard person to person to quantify pain is another problem. The other thing is orthotics are very much about adjusting them. There is a trial and error nature to orthotics that just can't be eliminated. So when the patient comes in a month later on their follow-up, the result will be different depending on how the orthotics are adjusted according to what the patient is telling me. So adjusting the orthotics is a big part of the outcome of orthotics. And I'm not sure that that's in any of these research articles. They really never seem to mention it. So that's a key part of the problem. So, but I've been a podiatrist for 30 years. My expertise is biomechanics, and I've made a lot of orthotics, probably tens of thousands, maybe 100,000 orthotics. I've treated a lot of back pain. Patients come to me from orthopedists, physiatrists, physical therapists. The patient is confused. Why am I going to a foot doctor? It's my back that hurts. My foot is perfect. So they're a little confused when they come in, and I have to explain to them why orthotics might help back pain. And I'll show you quickly on the skeleton. So the foot is made out of a lot of bones and a lot of articulations. The foot connects with the ankle bone to the leg here. And if you have a slight angulation of the heel bone, this articulation, and this is the bone in your body that has the most surface area of any joint in your entire body. Small motions of your heel will affect the position of your ankle bone, and the position of the ankle bone will affect the position of your leg. So you can see how this could relate to hip, knee, and certainly back pain. If you have a rotation here that's occurring, it will affect the position of the pelvis and spine. And that's called kinetic chain. So what that means is that one position down the road affects the next, which affects the next, which affects your back. So that's the connection there that sometimes patients don't understand when the back doctor sends me a patient. So that's important. One way that orthotics work to help back pain, they correct the kinetic chain, put the feet in front of the body, and then you have a more smooth and efficient gait, and that's going to help with the position of the pelvis, which obviously would improve the performance of the spine. So kinetic chain is one of the reasons why orthotics help back pain. Another one is actually a very simple thing. It's total contact. And that means that if you have a model of the patient's foot and you make the mirror image of it exactly with a pair of orthotics, that means when the patient walks, they're going to feel every square inch of the bottom of their foot. And this is going to send more information to the cerebellum, which is your balance center. So orthotics, in a very general way, do improve balance because there's more information going to the cerebellum. So if your balance is better and you're moving your muscles in a more efficient manner because your cerebellum, your hand-eye coordination, foot-eye coordination center is working better, your gait will be better. So that will also improve back pain. And the last thing I want to talk about with lower back pain and orthotics is the materials. The choice of materials is very important. So with the lower back pain, I like to pick a closed cell ethyl vinyl acetate material, which is a modern rubberized plastic. And it's high density, so that means the rebound is excellent. So you take a step, and the closed cell means a cell full of air that you're going to compress. But it's a closed cell, so the air can't escape. And rebound means that when you are swinging your leg, the cell will rebound, and then it'll be round again like that. So the material itself provides shock absorption, and certainly, no matter what the cause of the low back pain is, whether it's arthritis or a disc disease, less shock is less impact. That's certainly going to help. So the choice of modern materials is very important in making orthotics. In the old days, they used to use hard, brittle plastics that were very inflexible. So the modern materials that I like to use are very flexible. So we have motion in the foot, and then the foot, which is designed to absorb shock, will be able to do its job properly, and you'll have less shock going to your lower back. So that's it in a nutshell. That's how orthotics help lower back pain. And if I'm in Manhattan, if you're in the area, Big Apple area, you can hear the sirens. Welcome to Midtown Manhattan. These guys are practicing there. There's no fire. They're just driving around constantly. So come on in and, I can make your orthotics. Like I said, I've helped people over 30 years. I would say I can't really off the top of my head think of someone who wasn't helped at all with their lower back pain. They might have been helped less, and some patients were helped very, very much. I think certainly it's worth trying to have a pair of orthotics made if you have lower back pain. It's not going to cure your lower back pain. It's an adjunct to your lower back pain therapy, but it could make the difference between having a good day and a bad day. And the goal with lower back pain is to have more good days than bad days. Okay, thank you very much for watching the video. And if you like my videos, please click the subscribe button, and that will allow you to see the new videos that we post.